Managing COPD. Remember, the goal here is helping the patient move air more efficiently, effectively, while slowing the progression of the lung damage. COPD is a chronic condition where the airway stays inflamed and narrowed, and the lung tissue gradually loses its ability to recoil. Now, because the lungs cannot push air out efficiently, air becomes trapped and patients develop that constant sensation of breathlessness. The first step in managing it is opening the airways. This is done with a medication called the bronchodilators. Now remember, bronchodilators relax the smooth muscle surrounding your bronchial tubules. Now this allows more airflow through the lungs. Now short-acting inhalers are commonly used when patients suddenly feel short of breath. One widely example used is the albuterol. Now this acts quickly to expand our airways and improve our breathing. Remember, many patients also require the long-term maintenance therapy. That is the long-acting bronchodilators. Now these are designed to keep the airways open throughout the day rather than only during the sudden symptoms. Now, medications such as tiotropium works by maintaining the bronchodilation for extended periods. Now, this helps patients breathe more comfortably during daily activities. Another aspect of COPD treatment is reducing the airway inflammation. Now, in some patients, inhaled corticosteroids are prescribed to calm the inflammatory process occurring inside their bronchial walls. Lower inflammation means fewer exacerbations and less damage to the lung tissues over time. It is very important. Now, some patients eventually require supplemental oxygen therapy. Now, when lung function declines, oxygen levels in the blood may also fall below the normal range. Remember, carefully administered oxygen helps maintain adequate tissue oxygenation. It is very important now. Clinicians must monitor oxygen levels closely because excessive oxygen can sometimes suppress the respiratory drive in the patients who have the advanced COPD. Very important. Now, lifestyle management also plays a major role. Smoking cessation is the most critical intervention for slowing your disease progression. It is very important now. Pulmonary rehabilitation programs such as breathing techniques like the pursed lip breathing, regular physical activity. Now, these also have been proven to strengthen respiratory muscles and improve endurance. It's very much proven. Now, healthcare providers must watch for COPD exacerbations. Very important now. If a patient suddenly develops increased coughing, more sputum production, worsening shortness of breath, that may signal an acute flare-up that requires additional bronchodilators or corticosteroids or sometimes the antibiotics. Now, COPD management focuses on maintaining airflow, controlling inflammation, preventing exacerbations, and supporting the oxygen delivery. Now, when these elements are managed well, patients can maintain a better lung function and a higher quality of life despite the chronic airway disease. The chronic obstructive pulmonary disease, that is a COPD. I need us to always pay attention to the function of our lungs. It's very much important to you. It's very much important to me. I'm going to see you soon. My name is Nurse Solomon.